So as Sonia just said, I am the site lead for CDL-Toronto, and I'm here to introduce a company from our Neuro stream. And the stream mission is to support founders with novel innovations in neuroscience. It's been a really exciting stream, and I'm very happy to introduce Brad Schmidt from Panaxium. They are developing ultra-precision personalized neurostimulation therapy for stroke patients. Their founders, Brad Schmidt and Pierre Lelot, met in 2015 through connections at Cornell. During his PhD at Cornell, Brad became an expert in building these nanoscale microdevices for biomedical applications. And then he and Pierre were inspired to start Panaxium because they saw an opportunity to combine their complementary engineering and scientific expertise into this particular high-impact solution for a massive unmet need. One of our neuro mentors, Jamie Stiff, has been mentoring the venture from the very first session up until now, alongside others, and we are really happy to see the progress Brad and his team have made in preclinical studies, fundraising, and revenue generation. So please join me in welcoming Panaxium.
I'm going to speak from the podium because for this I actually wave my arms intentionally. So, hello everyone, I'm Brad Schmidt, and I am the co-founder and CEO of Panaxium. And we are solving one of the greatest hardware challenges of healthcare challenges of our time, which is how to heal the brain following a debilitating stroke injury. Stroke is the greatest cause of physical disability in the world today. In fact, the societal costs of stroke are now rivaling that of all cancers combined. And amazingly, the only standard treatment is physical therapy, which leaves the vast majority of patients with some type of lifelong disability or impairment that they and their families have to suffer through. And for us here today, it's coming for us. It is now projected that 1 in 4 of us will suffer a stroke in our lifetime, and we're most likely to survive and most likely to be disabled. And essentially, all of us will have friends and family who are affected by this. But it doesn't have to be this way, because the brain has this amazing ability to heal itself using neuroplasticity. An extraordinary thing happens when neurons die from stroke. Remaining neurons rally. They try to reorganize themselves. They try to trade off the responsibilities of the functions that were lost to the injury. And this is why people do physical therapy, because physical therapy and the repetitive motion encourages these natural recovery processes. But unfortunately, left to its own devices, only a tiny, tiny percentage of those patients actually ever reach a full recovery. And importantly, no two brains and no two brain injuries are alike. Here are 2 scans of patients. You'll notice that they're similar, but they're obviously different enough in ways that matter. So the connections in my brain that control my arm are going to be different slightly than those that in your brain that control your arms. And layer on a brain injury like stroke, and the differences become immensely greater. This is why we've developed a therapy that accounts for this variability among brains, which is an ultra-personalized neurostimulation therapy, which supercharges this neuroplasticity or mapping process, we call it. So with the use of a temporary implant that's placed on the surface of the brain, we're able to locate, then selectively stimulate the best places to help the brain recover and benefit the neurons that are working hard underneath them to remap and try to overcome and take over these functions in healthy tissue. Now, we know that neurostimulation works because decades of work in the field of neuroscience and in human clinical trials have demonstrated that it does work. The problem is that the lack of precision leads to an inability to achieve certain criteria for recovery, and that means that only a small percentage of patients are ever helped. We overcome that, and precision is key to personalization. So if we look at our own preclinical studies, here's an example where we take one of our devices on the surface of the brain and place tiny little electrodes near but not on where the stroke has been in the subject. We're able, by playing different combinations of these different electrodes, turning them on and off, actually control different movements. And if we're able to isolate those, that's key to getting a better recovery. This is the approximate resolution of other approaches. With this, you can't properly stimulate the brain and help it recover by isolating it, isolating these different movements. Effectively, this is like trying to play the piano with boxing gloves on. This is our differentiator. We can create a personalized therapy that ensures the patient is going to optimally respond, and that means a quicker, greater recovery. How do we do this? We create an implant that stimulates using electrolytes, not electrons, which enables us to provide the precision necessary. Very different from other devices. And then this is paired with proprietary imaging analysis to target the right spots for stimulation even before implantation. This market has always been there, but now we have the ability to address it with our technology. We are focused on where the development is most advanced, which is for recovering upper limb motor problems. And while alone, this is hundreds of thousands of patients a year just in the United States, there's huge opportunities to expand to other types of stroke disability and beyond. Sorry, just one slide before there. Now, coming to CDL, we had accomplished to date a lot of development and validation of our technologies. And what we were guided through in this process to answer the questions that make investment in our business case much easier. For example, our mentors have encouraged us to dive deeper into figuring out exactly how our anticipated performance advantages translate into reducing the cost and reducing the risks for proving this out in human clinical trials. We've used our time with CDL to prepare, and now we're taking the opportunity today to launch our Series A round here at the Super Session. We are looking to raise $20 million in order to fund the completion of our human clinical safety and feasibility data, which is a major inflection point towards bringing this therapy to market. We are asking the CDL community, if you share a vision for this massive impact and know investors who value these high impact business opportunities, come find us. We'd love to talk to you. There's so much more I'd like to share with you. Please come and find me. I look forward to continuing this conversation together. Thank you.